Unexpected health benefits from plastic surgery. Hey everyone, this is Dr. Shim Ching, board-certified plastic surgeon in Honolulu, Hawaii. Everybody thinks plastic surgery is only skin deep, but actually some of the procedures I do have added benefits, and it's not just cosmetic. Just to give you a little bit of background on myself, I'm a plastic surgeon, been doing this for 25 years. My main practice is in Honolulu, Hawaii. However, I do practice in Dubai and Qatar. I have one of the busiest practices in the United States. I've received training both in Canada and the US, as well as other countries such as Brazil, Colombia, South Korea, and Japan. So I'd like to give you 3 examples of 3 procedures that I do that have added health benefits in addition to making a patient look better. The first one is rhinoplasty. Now, rhinoplasty is essentially changing the shape of the nose. However, there are some internal structures that block airflow. Airflow obstruction could be caused by a deviated septum, which is the plate of cartilage in between the 2 sides of the 2 nasal passages. And this can be strongly deviated to one side, crooked, in some way blocking the airflow, usually on one side of the nose. This is an extremely common reason to have nasal obstruction. This could be as a result of trauma, or a lot of people are born with this deviated septum. The good news is that this could be corrected with a rhinoplasty, and we call this a septorhinoplasty. Septo meaning changing the shape of the septum of the nose, and in this case straightening it so that airflow can be better. There are other structures inside the nose called the turbinates, and these are scrolls of soft tissue that are designed to increase the surface area of the inside of the nose. These also can be enlarged sometimes just naturally or sometimes in response to allergies, but this structure can also be reduced to improve airflow. These are very common things for me to do in addition to rhinoplasty at the same time, so that not only are we making a patient look better, we can also make them breathe better, which can really enhance a patient's exercise tolerance, make them smell better so they can appreciate things like wine and food, and overall just improve the patient's well-being. The second example I'd like to give you is a breast reduction or breast lift. Breasts can be quite large and droopy, and as they sag, this can cause gravity and tension to build up in the neck and the shoulders and the upper back. Very large breasts are a medical reason to get a breast reduction, but we also see patients who may not qualify for a breast reduction and have their breasts lifted or reduced, and this alleviates this tension on the neck and the upper back. This procedure, again, has added benefits. In addition to making a patient look better, they also feel better. The third example I'd like to give you is tummy tuck. Now, everybody knows tummy tuck is usually for somebody who's had kids or somebody who's lost a lot of weight, and this is improving the shape of the abdomen, making it flatter, tighter, removing loose skin. But there are 2 functional aspects of a tummy tuck that can improve the patient's health. One is removal of excess skin. Sometimes the skin is in so much excess that this is hanging and it can cause pain in the back. Loose hanging skin can cause things like rashes or moisture accumulating in that fold of skin, which can be quite unhealthy and bothersome to a patient. So removing the skin can really improve a patient's quality of life. The other thing I do in a tummy tuck is to tighten the abdominal wall. Relocate the abdominal muscles back into the midline after they've been stretched by a baby or with significant weight gain. Because as you gain weight, you also gain weight inside your abdomen, around your organs. We call that visceral fat, and that can stretch out your abdominal wall, similar to the way that a baby does. When we relocate the core muscles, the abdominal muscles, the core is a lot stronger. It's just like having a muscle in an abnormal position, it can't function as well. So when we strengthen that core, often a patient's back pain can improve because they're able to engage their core to balance between the core and the back muscles. I've had many patients who are uncomfortable because of the spreading of the abdominal muscles, and we call this diastasis recti. They either feel that their core is not as strong or they have significant lower back pain. And I've been really happy to be able to help them because when we tighten their abdominal muscles and their abdominal wall, they just feel a lot better and feel a lot stronger. So there you have it. Those are 3 ways in which cosmetic surgery can actually benefit a patient in other ways. If you like this content, please give us a like down below, give us a comment, and subscribe to this channel, and we'll catch you next time. Thank you.